Hi everybody and welcome to my channel hube tabibi. Today I am going to discuss a very important topic and that is commonly encountered in our clinical practice. I am talking about anxiety disorders. Earlier I posted a short overview about this disorder on my channel. I hope you have already seen that video. And today I am going to discuss this illness in detail. Well, experiencing occasional anxiety is a normal part of life. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, and these are known as panic attacks. These feelings of anxiety and panic interfere with daily activities. They are difficult to control, are out of proportion to the actual danger, and can last a long time. You may avoid places or situations to prevent these feelings. Symptoms may start during childhood or the teen years and continue into adulthood. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, also known as social phobia, specific phobia, and separation anxiety disorder. You can have more than one anxiety disorder. Sometimes anxiety results from a medical condition that needs treatment. Whatever form of anxiety you have, treatment can help. Please note that this is a video about anxiety disorders and there are so many types of anxiety disorders, and I hope if I get a time I will post a video about each anxiety disorder. Okay, now let me tell you the symptoms. Common anxiety signs and symptoms include feeling nervous, restless or tense, having a sense of impending danger, panic or doom. I have already posted a video about panic attacks and panic disorder on my channel. That video is very informative and interesting. If you find a time and if possible you can see that video. Okay. Other symptoms are having an increased heart rate, breathing rapidly, that is hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping, experiencing gastrointestinal problems or symptoms, having difficulty controlling worry, having the urge to avoid things that trigger anxiety. Now I will tell you about several types of anxiety which include agoraphobia. This is a type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. Another type is anxiety disorder due to medical condition, which includes symptoms of intense anxiety or panic that are directly caused by a physical health problem. Then third type is generalized anxiety disorders. Generalized anxiety disorder include persistent and excessive anxiety and worry about activities or events, even ordinary routine issues. The worry is out of proportion to the actual circumstance and it is difficult to control and affects how you feel physically. It often occurs along with other anxiety disorders or depression. Panic disorder. Panic disorder is also a form of anxiety disorder, and as I told you before, I have already a good video about panic disorder on my channel. You can see that video. Okay, this panic disorder involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, and these are known as panic attacks. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart. These are known as palpitations. These panic attacks may lead to worrying about them happening again or avoiding situations in which they have occurred. Selective mutism is a consistent failure of children to speak in certain situations such as school, even when they can speak in other situations such as at home with close family members. This can interfere with school, work, and social functioning. So this selective mutism is also a type of anxiety disorders. Then there is another disorder that is known as separation anxiety disorder, which is a childhood disorder characterized by anxiety that is excessive for the child developmental level and related to separation from parents or others who have parental roles. And another type is social anxiety disorder, also known as social phobia. This involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Then there are specific phobias, which are also a type of anxiety disorder. These are characterized by major anxiety when you are exposed to a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people. There is a video about claustrophobia on my channel with BB. That is very interesting video. So these phobias, which include claustrophobia, are also part of anxiety disorders. Okay, and you can see that claustrophobia video on this channel. Okay. Substance induced anxiety disorder is characterized by symptoms of intense anxiety or panic that are direct result of misusing drugs, taking medication, being exposed to a toxic substance, or withdrawal from drugs. Okay, so this substance induced anxiety disorder is another type. Other specified anxiety disorder and unspecified anxiety disorders are terms for anxiety or phobia that do not meet the exact criteria for any other anxiety disorder but are significant enough to be distressing and disruptive. So sometimes we come across patients who have very unspecified anxiety disorder. Okay. You should see your doctor if you feel like you are worrying too much and it's interfering with your work, relationships, or other parts of your life. You fear, worry, and anxiety is upsetting you and difficult to control. You feel depressed, have trouble with alcohol or drug use, or have other mental health concerns along with anxiety. In all these situations, you should see your doctor. You think your anxiety could be linked to a physical health problem. You have suicidal thoughts or behavior. If this is the case, seek emergency treatment immediately. If sometimes anxiety is linked with depression, or depression is commonly associated with anxiety, and if you have suicidal thoughts, then these are very dangerous and you should seek immediate medical attention. Okay. Your worries may not go away on their own, and they may get worse over time if you don't seek help. See your doctor or mental health provider before your anxiety gets worse. It is easier to treat if you get help early. If you have seen videos on my channel, this principle is applied generally to all kind of illnesses. When you seek immediate medical attention in any illness, it is easy to treat. Okay, same is the case with anxiety disorders. Okay. Now let me tell you the causes. The causes of anxiety disorder are not fully understood. Life experiences such as traumatic events appear to trigger anxiety disorders in people who are already prone to anxiety. Inherited traits also can be a factor. Now I'll tell you some medical causes. For some people, anxiety may be linked to an underlying health issue. In some cases, anxiety signs and symptoms are the first indicator of a medical illness. If your doctor suspects your anxiety may have medical cause, he or she may order tests to look for signs of a problem. Examples of medical problems that can be linked to anxiety include heart disease, diabetes, thyroid problems such as hypothyroidism. I have a video about hypothyroidism on my channel as well. That is very informative video. You can see that. Okay. Respiratory disorders such as chronic obstructive pulmonary disease and asthma. On both of these illnesses, COPD and asthma, I have videos on my channel. Okay. Then other medical cause is drug misuse or withdrawal. Withdrawal from alcohol, anti-anxiety medication, the benzodiazepine or other medications can also be a cause. Okay. Chronic pain or irritable bowel syndrome. I have already uploaded a video about irritable bowel syndrome on my channel. You can see that video. Okay. Then there are certain rare tumors that produce certain fight or flight hormone that can also cause anxiety. Sometimes anxiety can be a side effect of certain medication. It is possible that your anxiety may be due to an underlying medical condition. If you do not have any blood relatives such as a parent or sibling with an anxiety disorder, you didn't have an anxiety disorder as a child, you don't avoid certain things or situations because of anxiety, you have a sudden occurrence of anxiety that seems unrelated to the life event, and you didn't have a previous history of anxiety. So if you have this kind of situation, then your anxiety could be due to underlying medical condition. Okay. Now I'll tell you the risk factors. These factors may increase your risk of developing anxiety, which include trauma. Children who endured abuse or trauma or witnessed traumatic events are at higher risk of developing an anxiety disorder at some point in life. Adults who experience a traumatic event also can develop anxiety disorders. Stress due to an illness. Having a health condition or serious illness can cause significant worry about issues such as your treatment and your future. Stress built up. A big event or a build-up of smaller stressful life situation may trigger excessive anxiety, for example, a death in the family, work stress, or ongoing worry about finances. Personality. People with certain personality types are more prone to anxiety disorder than others. Other mental health disorders. People with other mental health disorders such as depression often also have an anxiety disorder, as I told you before. Having blood relatives with anxiety disorder. Anxiety disorders can run in families. Drugs or alcohol use or misuse or withdrawal can cause or worsen anxiety. Now let me tell you the complications. Having an anxiety disorder does more than make you worry. It can also lead to or worsen other mental and physical conditions such as depression, which often occurs with an anxiety disorder or other mental health disorders. Substance misuse. These things which substance misuse can also lead to anxiety, but some people after developing anxiety disorder start misusing substances, so this can be a complication. Okay, another complication is trouble sleeping, that is insomnia. Some other complications are digestive or bowel problems, headaches and chronic pain, social isolation, problems functioning at school or work, poor quality of life, and suicide. So these are suicide is obviously a very serious complication. If you have these kind of thoughts, you should seek urgent medical attention. Now let me tell you about prevention. There is no way to predict for certain that will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of symptoms if you are anxious. You should get help early. Anxiety, like many other mental health condition, can be harder to treat if you wait. You should stay active. Participate in activities that you enjoy and that make you feel good about yourself. Enjoy social interaction and caring relationships, which can lessen your worries. Avoid alcohol or drug use. Alcohol and drug use can cause or worsen anxiety. If you are addicted to any of these substances, quitting can make you anxious. If you cannot quit on your own, you should see your doctor or find a support group to help you. Now let me tell you about the diagnosis of anxiety disorder. When patients come to us, we examine you. In general, we take a proper history and we'll do physical examination, and then we can check for signs of an underlying medical condition that may need treatment. As I told you before, there are certain medical conditions which are responsible for anxiety, so we have to rule out other medical conditions. Okay. However, you may need to see a mental health specialist if you have severe anxiety. Sometimes when as a physician, sometimes we manage most of the cases of anxiety, but sometimes if the problems are severe, and then sometimes we refer the patient to psychiatrist. Okay. Psychiatrist is a medical doctor who specializes in diagnosing and treating mental health conditions. A psychologist and certain mental health professions can diagnose anxiety and provide counseling, which is psychotherapy. To help you diagnose anxiety disorder, your doctor may give you a psychological evaluation. This involves discussing your thoughts, feelings, and behavior to help pinpoint a diagnosis and check for related complications. Anxiety disorder often occur along with other mental health problems such as depression or substance misuse, which can make diagnosis more challenging. Compare your symptoms to the criteria in DSM-5. While DSM-5 is an abbreviation for Diagnostic and Statistical Manual of Mental Disorder, which are published by American Psychiatric Association. So we use these criteria to diagnose anxiety disorder as well. Okay. Now coming to the treatment. The two main treatments for anxiety disorder are psychotherapy and medication. You may benefit most from a combination of the two. It may take some trial and error to discover which treatment works best for you. First, I'll tell you something about psychotherapy, which is also known as talk therapy or psychological counseling. Psychotherapy involves working with a therapist to reduce your anxiety symptoms. It can be an effective way for anxiety. Cognitive behavioral therapy, that is CBT in short form, is the most effective form of psychotherapy for anxiety disorders. Generally, a short-term treatment CBT focuses on teaching you specific skills to improve your symptoms and gradually return to the activities you have avoided because of anxiety. CBT includes exposure therapy, in which you gradually encounter the object or situation that trigger your anxiety, so you build confidence that you can manage the situation and anxiety symptoms. Medications. Several types of medication are used to help relieve symptoms depending on the type of anxiety disorder you have and whether you also have other mental or physical health issues. For example, certain antidepressants are also used to treat anxiety disorders. An anti-anxiety medication called buspirone may also be prescribed, which is a very famous drug. Okay. In limited circumstances, your doctor may prescribe other types of medications such as sedatives, also called benzodiazepines or beta blockers. These medications are for short-term relief of anxiety symptoms and are not intended to be used long-term. You should talk with your doctor about benefits, risks, and possible side effects of medications. Now I'll tell you about lifestyle and home remedies, which are also very important to note down. While most people with anxiety disorder need psychotherapy or medication to get anxiety under control, lifestyle changes which I'm going to tell you can make a big difference. And these changes are: you should keep physical activity, keep physically active, developing a routine so that you are developing a routine so that you are physically active most days of the week. Exercise is a powerful stress reducer. It may improve your mood and help you stay healthy. Start out slowly and gradually increase the amount and intensity of your activities. Well, on my channel Hube tabibi, I have posted a video about this, the 2 golden principles of life. That is a very important video. If you haven't seen already, I strongly recommend to see that video, in which I have discussed the 2 principles of life. If you adopt those 2 principles, and then you can stay healthy and you can prevent so many other illnesses. Okay. And then another lifestyle and home remedy that you should avoid: alcohol and recreational drugs. These substances can cause or worsen anxiety. If you cannot quit on your own, see your doctor or find a support group to help you. You should quit smoking and cut back or quit drinking caffeinated beverages. Both nicotine and caffeine can worsen anxiety. Use stress management and relaxation techniques. Visualization techniques, meditation, and yoga are examples of relaxation techniques that can ease anxiety. Well, on my channel, I not only discuss different diseases, I also have a special playlist which is for music therapy. Listening to soothing music can also reduce anxiety, and you can see that separate playlist, and there are so many musical videos in that. Okay. Also, you should make sleep a priority. Do what you can to make sure you are getting enough sleep to feel rested. If you are not sleeping well, you should see your doctor. Eat healthy. Healthy eating, such as focusing on vegetables, fruits, whole grains, and fish, may be linked to reduce anxiety, but more research is needed. Now, there are some alternative medicine, some herbal medicine which people recommend on different channels, but personally, because these drugs are not FDA approved, so I do not recommend these alternative medicine. Okay. And because these alternative medicine can be risky, especially if you are taking these medicine along with the medicine as prescribed by us. I mean, if you are using allopathic medicine and you start using alternative medicine, then that could be dangerous. So personally, I do not recommend any alternative medicine for these this anxiety disorders. Okay. I mean, even if you are seriously impressed by a certain alternative medicine, then you should speak to your doctor before taking that kind of medicine. Okay. You should learn about your disorder. You should talk to your doctor or mental health provider, find out what might be causing your specific condition and what treatments are best for you. Involve your family and friends and ask for their support. You should stick to your treatment plan, take medication as directed, keep therapy appointments, and complete any assignments your therapist may give you. Consistency can make a big difference, especially when it comes to taking your medication. You should take action, learn what triggers your anxiety or cause your stress, but practice the strategies you develop with your mental health provider so you are ready to deal with anxious feeling in these situations. Keep a journal. Keeping track of your personal life can help you and your mental health provider identify what's causing you stress and what seems to help you feel better. Join an anxiety support group. Remember that you are not alone. Support groups offer compassion, understanding, and shared experiences. There are some so many groups which you can find online. Okay, you can learn time management techniques. You can reduce anxiety by learning how to carefully manage your time and energy. Do not forget to socialize. Do not let worries isolate you from loved ones or activities. You should break the cycle. When you feel anxious, take a brisk walk or delve into a hobby to refocus your mind away from your worries. Okay, so this was my detailed video about anxiety. I hope you have liked this video. And since this channel of BB is basically meant to help humanity across the world, so do not forget to share these videos with others. Those people who are in need. Okay, thank you very much for watching this video. See you in next video. Bye for now.